This is how Cristiano Ronaldo looked before his plastic surgery. This is how he looks now. This is Kim Kardashian before her plastic surgery, and this is how she looks now. This is Kylie Jenner before her plastic surgery, and this is how she looks now. This is Cardi B, this is Priyanka Chopra, this is Shruti Hassan, Anushka Sharma before her plastic surgery. They all look fairly good after the plastic surgery, right? But wait, this is Courtney Cox, who played Monica in the iconic television series Friends. She admitted that her previous plastic surgery left her looking really strange, and that now she's regretting her choices.
I have done things that I, regret, and luckily there are things that dissolve and go away. So that's good, because sometimes you find yourself trying and then you look at a picture of yourself and go, oh God.
Yeah.
Like, you look horrible.
Courtney Cox isn't the only celebrity who has undergone a failed plastic surgery. The list of celebrities and the stories behind their failed plastic surgery procedures continue to rise. Not only that, the number of people dying due to tissue damage, infections, and psychological stress caused by unsuccessful cosmetic procedures is steadily increasing. This is the dark side of the cosmetic industry that no one is talking about. Why do these people end up looking so awful after undergoing plastic surgery? Why are so many people losing their lives today? What exactly is going on here? We will show you in this video. What's up people, this is John Joseph, welcome to TED. Korea is said to be the world's plastic surgery capital. According to BBC, 1 out of every 3 women in Korea has done plastic surgery. In Korea, your appearance is used to judge you. People say that having a better face gives you an advantage in almost every situation. When you apply for a job, you must include a photo with your resume. And if there is someone more attractive than you will probably lose the chance of getting that job. In most cases, Korean mothers ask their children to get a plastic surgery. People in Korea openly admit that students as young as 9th grade have plastic surgery done there. Some of them even reveal that they were given money for plastic surgery by their parents when they graduate. With Instagram and other social media apps promoting photos and selfie culture, Gen Z today desires to appear more perfect. They say that the new trend is to have a smaller waist with bigger breasts and butts. They are now willing to go to any length to look like their favorite celebrities. Cosmetic surgeons and clinics are showcasing their work on social media to attract people as if it were a simple procedure that could be done at any time. They have countless posts on Instagram with before and after videos and not even a single negative review. After seeing these Instagram posts and testimonial videos, people approach these celebrity doctors and they are convinced into body modifying surgeries. The Brazilian butt lift or BBL is one of the most common cosmetic surgeries performed in the industry. This is a procedure in which liposuction is performed on your stomach, thighs or arms, and the fat collected is then transferred into your butt cheeks. Liposuction is a technique in cosmetic surgery for removing excess fat from under your skin by suction.
The Brazilian butt lift is one of the most popular cosmetic procedures in the country, but it is also said to be the deadliest. A big concern is that fat is injected into the wrong place and can directly travel to the heart or into the lungs, resulting in death.
Professional surgeons can charge anywhere from $8,000 to $10,000 for this procedure. In reality, these procedures are extremely expensive for ordinary people to undergo. But how do an average people get a BBL? That is when women begin to turn to black market for silicone butt injections, where they can be done for $1,000 and all the injections can be done in one day. A silicone is a polymer made up of siloxane. They are typically colorless oils or rubber-like substances. These are used as volumizing substances and are injected directly into breasts and buttocks of the patients in order to augment their size. Unprofessional silicone injections are said to be deadly.
The Sydney woman who suffered a heart attack while undergoing breast enhancement surgery on Wednesday has died in hospital.
The clinic's 35-year-old owner was Jean Huang. She died after having dermal filler injected into her breasts under local anaesthetic. The 2 women who carried out the procedure were not registered as medical practitioners in Australia. Both are now facing manslaughter charges.
In this video, the patient talks about the strange way she was treated.
It was $1,000 and we met the lady who would then inject us. And as you're getting injected, it's feeling like fire being pushed into your body. It's very bad. It's excruciating pain. She's putting crazy glue, the regular crazy glue you get from the dollar store.
She says that after the silicone injections, the person who treated her closed the surgical cut with super glue from a regular store so that the silicone substance wouldn't leak out.
with cotton balls that then close it up.
This woman put crazy glue on an open part of your body.
Yes.
Most clinics and people performing these surgeries appear to be giving their patients terrible experiences. This video shows a strange footage of doctors dancing while inserting long stainless steel cannulas into an unconscious male patient behind the closed doors of his clinic. And this video was shot in the operating theater while the patient was unconscious and naked, and the doctor was hitting a fly. To reduce the risk of infection, an operating theater is designed to be an isolated and protected area. The presence of a fly in an operating room indicates that the system has failed, and the patient was left completely naked with no covering at all, while the doctor attacked the flies with the blanket. It is known that keeping a patient warm is one of the most important and critical adjustable factors in preventing infection after surgery. But it is at this filthy location where they have carried out 3 massive liposuction procedures. Another shocking aspect of these cosmetic clinics is that many of the surgeons performing these potentially life-threatening procedures are not specialists. A cosmetic surgeon can be anyone with a basic medical degree. Even though their social media accounts might make you think so, these doctors are not specialist surgeons.
In the United States of America, any medical doctor can do plastic surgery.
So a pediatrician could
That's
do plastic
correct.
surgery.
A pediatrician can do cosmetic surgery.
And these doctors that aren't plastic surgeons, how much training are they getting before they operate?
There are all kinds of weekend courses that these doctors can take in a hotel. It's like a cookbook. The problem is if you get into a problem and it's not in the cookbook,
What do you do then? Yeah.
you call 911.
Because of the legal loopholes, they can perform major surgeries despite having little surgical training. In the majority of these cases, patients are not informed of the actual risk associated with these surgeries. If there is a problem after surgery and the patient is not emotionally or financially stable, the results can be disastrous. If the surgery goes wrong, a person who is already insecure about one aspect of their appearance may suffer a serious blow to their confidence. At the same time, many patients borrow money for the initial surgery. If they require an additional procedure, the cost involved can devastate their financial situation. Liposuction, according to one recent study, may reduce one problem while creating another. Suctioning fat from thighs and lower abdomen eventually destroys the fat cells. When they regain weight, it is distributed unevenly, frequently to the less flattering areas such as the upper abdomen, back and arms. The story in India has also not been different. India is said to have 150,000 breast augmentation surgeries every year. The market has seen a surge in recent years, and it is expected to remain in high demand throughout the forecasted period. The desire to look young has increased the demand for aesthetic treatments. The most common plastic surgeries in India are breast augmentation, liposuction, and nose reshaping. See, these surgeries aren't entirely bad. There are professionals that do a great job in this industry, and there are people who had decent results after surgery. If you're planning to do any of it, consider some key factors such as your expectation, expenses, risks, and recovery. Find a qualified cosmetic surgeon and consult with him. Let him evaluate the part of your body that you want to be treated, and then talk about your medical history, current medications, and discuss your desires and expectations. After all this, if the doctor agrees to do the procedure, then go for it. If the doctor says no, then it's a no. Thanks for watching the video, but wait a minute. Click on this shocking video to see how brutally delivery workers are treated in India by Zomato and Swiggy. They're treating them like slaves and customers are slapping them.